Hello, and welcome to our Chapter 25 lecture on Principles of Electrocardiography. So, learning objectives for 25.1. Define and spell and pronounce terms listed. Illustrate the electrical conduction system through the heart and discuss the cardiac cycle. Explain the concepts of cardiac polarization, depolarization, and repolarization, and identify the PQRST complex on an electrocardiographic tracing. We will also summarize the properties of the electrocardiograph and discuss the features of the electrocardiograph paper. Describe the electrical views of the heart recorded by the 12-lead EKG, and discuss the processes of recording an EKG and perform an accurate reading of an EKG of the electrical activity of the heart. We'll also compare and contrast electrocardiograph artifacts and the probable cause of each, interpret a typical electrocardiograph tracing, describe common electrocardiograph arrhythmias, summarize the cardiac diagnostic test and fit a patient with a Holter monitor, and discuss patient education and the legal and ethical issues involved when performing ECGs. So if you haven't noticed in your reading thus far, EKG and ECG are the same and they are used interchangeable. The ECG comes from the European, so we have the EKG, which is usually what we call it here. It's also known as the ECG. So you can see we are going to accomplish a lot this week. Let's get started. So electrocardiography amplifies the electrical impulses from the beating heart, and a pattern of these impulses is recorded on EKG paper. The role of the medical assistants in this EKG is that when you're performing an electrocardiograph, you should be able to recognize problems with the recording and make appropriate corrections so that the physician has a clear record of the patient's cardiac activity. The goal is to obtain the most accurate ECG possible. So this means, let me just give you an example of this. If you were going to set up the patient and you started the actual EKG and you noticed that it doesn't look correct, then you might start looking, you could stop it and you start looking at the leads. Are there any miscontacts? Did you put them in the right places? Are there any artifacts that could be involved? Maybe the patient has a phone in their pocket and haven't removed it and it's kind of messing up that electrical waves. So again, being able to recognize that things aren't right and knowing how to troubleshoot and fix it is very important. So what is the average length of time for a healthy adult cardiac cycle? It's 0.8 seconds. So a cardiac cycle includes all events that occur in the heart during one single heartbeat. So there are the phases of the cardiac cycle: systole, so the atria and ventricle contract and empty the blood, and diastole, and that's with the relaxation phase of the heart. And this is when the chambers refill with blood. The EKG records both the intensity of the electrical impulses and the actual time that it takes for each part of this cardiac cycle to occur. So here we're looking at the cardiac cycle, and I just want you to make sure when you're taking your notes that you take time to look at table 25 and really see the different stages there and understand. Figure 25.2 shows the electrical conduction system of the heart. So the sinoatrial, or the SA node, controls the rate of the heart contractions by initiating electrical impulses for about 60 to 100 times a minute there. So an arrhythmia is an irregular cardiac rhythm, and so we call an irregular cardiac rhythm an arrhythmia, conditions that interrupt the conduction pathway, so the SA node to the AV node to the bundle of His, to the right and the left bundle branches, can cause arrhythmias. So if there's any kind of interruption there, we can see arrhythmias. So again, let's look at polarization, depolarization, and repolarization in relation to this cycle. Polarization is the resting state. Okay, when the myocardial wall is at rest and there's no electrical activity occurring in this phase. So this is a straight line on the ECG strip. Then depolarization occurs, resulting in the contraction. So then it stimulates the heart muscle, it's contracted. Repolarization occurs when the heart muscle cells must return to a resting state. And the electrocardiograph records a series of waves, or also called deflections. And these correspond to the part of the cycle. So the PQRST complex. Why do you think the atrial repolarization is not recorded on the ECG strip? If you guessed that or thought that, it's because the electrical impulse is small and is hidden in the QRS complex. You are correct. The PR interval contains the P wave, the depolarization of the atria, and the spread of the electrical impulses through the AV node, bundle of His, and right and left bundle branches, and the Purkinje fibers. Sorry, Purkinje. I always say Purkinje, and it's Purkinje fibers. You got me again. Did you catch that? PQRST complex continued. So after the T waves comes a period of complete heart rest, also called polarization, which is indicated on the EKG as a straight line. A U wave occasionally can be seen as a small wave form just after the T wave in the patient with a low serum potassium level or a different metabolic disorder. So we can look at that, and occasionally if we see that U wave, we know that it's a possibility that the patient has low serum potassium levels or other metabolic disorders there. Then, by measuring the actual configuration and location of each wave in relation to the other waves and to the baseline, in addition to intervals between the waves and segments, the physician is able to detect rhythmic disturbances of the heart and identify different types of cardiac disorders. So we're looking again, QRS complex shows contractions of the ventricles and reflects the completion of cardiac depolarization. The QRS complex is recorded as a much more significant electrical activity than the P wave. The ST segment reflects the time between the end of the ventricular contraction and the beginning of the ventricular recovery. The T wave represents ventricular recovery, and the QT interval is the time between the beginning of QRS complex through the T wave. So this is a lot, and it will take a little bit of time to kind of go through and understand that, but you will get it. And it's actually extremely mind-boggling how we're able to capture this. Here's a picture of a basic EKG machine. And you may have noted our EKG machine. I know you have actually, because we did it in the beginning when we were doing our treasure hunt or our scavenger hunt. But they all look similar and have different features, but it's easy to look at them and know the basics. When you use them, it's really important that you read the manual and understand, because they all work a little bit differently. So the electrocardiograph machine record 12 leads simultaneously and are referred to as a 6-channel ECG or EKG machine. Limb and chest electrodes must be placed on the patient at specific anatomic locations before we can start that recording, and we're going to talk more about that. So here in figure 25.4, this shows the actual ECG paper. You need to know both the size and the meaning of each square in the ECG paper to understand the significance. So how do we interpret an ECG? We're going to talk a lot about that this week and for upcoming weeks. The horizontal axis represents time and the vertical axis represents amplitude. Therefore, 5 sequential large squares show the record of what occurred in the heart during the time span of 1 second. So 5 large squares times 0.2 seconds equals 1 second. That's how we get that information up to the 1 second. Another way to say this is that at normal speed, the ECG paper travels past the stylus at a rate of 25 millimeters per second, and voltage can be displayed as either a positive or a negative deflection. But really, when you're learning to read it, it's the easiest to understand that if we take 5 squares and we multiply by 0.2 seconds, that's how we get the 1 second intervals. So electrodes and lead wires. There are 10 sensors or electrodes, and these are placed on the patient arms. There's 2 arms and 2 legs, and then there's 6 leads on the chest area. They must be applied to specific locations to record the heart's electrical activity from different angles and planes, and these all line up together electrically, and that's why it's so important that they're placed in the correct anatomical area. The leads to the electrocardiograph carry cardiac electrical impulses into the machine where they are magnified by an amplifier. These amplified impulses are converted into mechanical action, which then this is recorded on the ECG paper by the stylus and shown also on the monitor. The frontal leads include leads 1, 2, 3, and VR, VL, and VF. The horizontal plane leads include the 6 precordial or chest leads V1 to V6. And here we see standard leads, and you can look at the different placements that it's showing: right arm, left arm. Okay, and then kind of the angles that what we're seeing here as far as how it travels and why that's important to place the leads correctly. The first 3 leads recorded are called the standard or bipolar leads because they each use 2 limb electrodes to record the heart's electrical activity. So how are these leads designated? These are the ones that are designated in the Roman numerals 1, 2, and 3. And that those are used, that's how we identify the 1, 2, and 3 when we're reading the ECG or EKG. Looking here, these are the augmented leads. These are designated augmented voltage right arm, so VR, augmented voltage left arm, so VL, and augmented voltage left leg, and that's the VF lead. So why do you think that these leads are referred to as augmented? Good. It's because the electrical activity recorded by these leads is relatively small, and the ECG machine amplifies or augments the electrical potential so that we're able to see it. So here we see the chest leads or the precordial leads. And the precordial leads or chest leads are unipolar and provide the transverse plane